This is our first mobile diagnostic unit with the Heartburn sponge test. So this is an early diagnosis test in the hope that we can find and diagnose esophageal cancer when it is curable.
Instead of that whole process, instead of needing a referral, instead of having to go to the hospital for an endoscopy, we just, in this van, can offer you to swallow the CYTOSPONGE, which is a little capsule on the string that you swallow, and will enable us to collect a cell sample that we can test.
You're given a capsule that's a bit like a large antibiotic capsule, but it's got a string on it. You just have to swallow that. Once it's in your stomach, the acid in there contributes to dissolving the capsule.
So the patients will be pre-screened before they actually turn up at the mobile unit. They will then come in our reception area, where we will ask them a few questions, and then they will then come through to the clinical room where we'll do the CYTOSPONGE.
Because my throat was quite dry, I was thinking it was going to be a struggle, but actually taking it with water, not too bad at all. It really wasn't too bad. Slightly bigger than I thought it would be, but just like a largish vitamin pill.
I've been working on this cancer for my whole career, and some years ago I started thinking, endoscopy is a real barrier here for patients, for clinicians. We need a much simpler way of doing this. So how can we move away from endoscopy, and what sort of device could we develop that would enable us to do it in a GP surgery?
Well, at the moment, most GPs don't have the trained staff who actually administer the CYTOSPONGE. A nurse needs some training before they can actually confidently ask you to swallow something and then retrieve it. So this gives an opportunity for the unit to go to different GPs and allow them to see how useful it actually is and how simple it is. It would be wonderful if this becomes a standard test for anyone who goes to their GP with problems with heartburn.
My husband died at the age of 47, 9 weeks after he was diagnosed with esophageal cancer. And he had had heartburn throughout his adult life and had self-medicated, which is why I'm so passionate about people being able to refer themselves to this.
I'm so proud that we've actually done this. This is the first time we've actually done the CYTOSPONGE in a mobile unit, and to actually be able to offer a test like this to patients in these times is actually quite an achievement.
An ultimate goal for this would be that GPs use this as their first line of test for people that they're seeing with heartburn, to decide who needs to be referred for an endoscopy, so that we can reduce the number of unnecessary endoscopies and really make sure that we are diagnosing Barrett's esophagus in people that otherwise wouldn't know they have it.
Longer term, the charity would love to see regular screening put in place, and that the CYTOSPONGE is available in primary care for everybody. So just like your smear test, your mammograms, those other screening tests, we would like it to be available so that if people need to be checked, they can be, because the earlier we catch cancer or Barrett's, the better.
They can come in, have the procedure, and within a few weeks they will get a result. Now, if they get a negative result, that's reassuring to the patient. If they then have a positive finding, then that could streamline that patient's care a lot better, and therefore that patient can then be seen a lot quicker within the hospital and get treatment a lot sooner, and that could make a really big impact on early detection of cancer or other sort of clinical symptoms.
Early diagnosis is absolutely vital. Esophageal cancer is a killer. The prognosis is appalling. But if through early diagnosis we can catch either esophageal cancer early or Barrett's esophagus, which is the precancerous condition, we can save lives. This will save lives.